What do you think the biggest obstacle is to implementing EHRs, and how would you overcome it? Here's what some of you had to say.
Probably the biggest obstacle in implementing electronic health records is physician adoption. Getting physicians and clinicians to use it, given their busy schedules and treating patients on a regular basis, especially in the outcare setting where they have such limited time to spend with each patient.
My opinion is, and you may hear differently from my colleagues, is that it's about people. So it's not about the technology, it's about the people and it's about the culture. So we have a tremendous amount of pushback and resistance because people don't like their cheese moved. And it requires a change in the way we think and the way we do. So it's not only our established ways of doing things, but it also has to do with relationships.
Adoption for an open standard to share the information that goes into an electronic medical record.
It's the people. I think it's I'm from South America, Brazil, and it's about this. It's about people and how people accept and they are willing to move it from the zone of comfort and be involved with technology and the investment. Money, it's also an issue, but I think it comes in the second place because if you have people, and people, it's not the people as users, but the people that decide what is adequate as technology.
Well, initially I think it was the cost. Everybody was concerned about the cost. Now with the incentives for the government, that's kind of moving away. The other big one is the reluctance of some physicians after many years of practice to change the way they do things.
Money, and policy. You need money to implement the policy. If the policy, which is happening with meaningful use, requires that an EHR be implemented, then it requires money to implement. Even if you don't want to, you have to.
I think we eliminate the obstacle by creating a good business case for helping everybody understand what the ultimate benefits are to electronic records, which of course includes improving outcomes for patients, as well as potential financial incentives that could result in higher physician or healthcare institution pay for providing care.
How do we overcome them? I think we're doing it. We're doing the right thing now with the government support and everybody's seeing that things are really changing. We need to use the electronic health record. We need to eliminate all those medical errors that cost people's lives. And we need to improve the cost of healthcare, control it. I think people are being convinced now, so it's happening.
Just getting vendor compliance, because number of vendor organizations want to push their own way of representing data in a medical record, and but most of them are also involved in the standards committees, so usually there's enough adoption where most vendors are willing to at least agree to a standard set of data.
But it's the leadership, and the leadership have to have the right process in order to implement the policy. From a perspective from the government, and I think in developing countries need to have a leadership team who knows the basic concept of what it means informatic in health.